Good morning, doctors. This is the first medical podcast for clinics of CGHS Pune. We have with us today Dr. Bedagkar, who is a skin specialist working with CGHS Pune. We are going to discuss with him case number 21, which was a case of T.corposris, published on the clinics of CGHS Pune last week. And most of the doctors got the diagnosis correct, but we will discuss with Dr. Bedagkar how common pitfalls or common mistakes done in treating these common fungal infections. So, Dr. Bedagkar, what is the common mistakes that you see around wellness clinics in CGHS for treatment of common fungal infections?
Ghadge, common mistakes or pitfalls while managing superficial fungal infections in day-to-day practice in CGHS clinics are as follows. Thorough clinical examination of the patient in well-illuminated area is required. Screen the patient for diabetes, for mild status, for tuberculosis. Ask patient is taking steroids, cytotoxic drugs, which makes him prone for the fungal infection. While case, there as one in all households, and if they are suffering, all to be treated simultaneously along with the index case. Stress should be given on personal hygiene, that is not to share clothes, towels, bed sheets. Cotton undergarments are to be used to absorb the sweat and to keep the area dry. Advise take frequent baths with ketoconazole shampoo or use topical antifungals like miconazole, ketoconazole, sertaconazole, ibuproconazole or terbinafine or levofine singly or in combination. Use systemics like gryzofulvin, fluconazole, terbinafine. Most important, continue the treatment for 6 weeks, 2 weeks after the lesion disappears, whichever is later. And please do not use topical steroids.
And the next question, Dr. Bedagkar, how do you see the fungal infections being treated over the years in wellness clinics? Have you noticed any particular pattern or with regard to antifungal agents used and its effectiveness?
It is observed that the fungal infections are becoming day by day resistant to the routine antifungal drugs, and therefore we need to use a new drug called as itraconazole singly or in combination with the old drugs like terbinafine, gryzofulvin or fluconazole.
So the last question, sir, is that we are going to upload few pictures of Tinea versicolor today. And what difference is there in the treatment of T.corposris and Tinea versicolor?
Regarding treatment of Tinea versicolor, the treatment and all the precautions remain same, except while treating the patient with systemic drugs, gryzofulvin and terbinafine are not effective, and therefore we have to choose alternative drugs systemically in the form of azole group, that is fluconazole, ketoconazole or itraconazole.
Thank you, Dr. Bedagkar, for your excellent talk. So, doctors, what we have seen today is the commonest cause of recurrent fungal infection is inability to treat it adequately for at least 6 weeks or 2 weeks after the lesion has disappeared, and taking care of the local factors like sharing of towels and clothes. And the difference between treatment of T.corposris and Tinea versicolor, where the systemic antifungal agents terbinafine and gryzofulvin do not work. Thank you again all.